This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and great to have you aboard. I'm your host, Dr. Steve Ambrose. For past and upcoming episodes, find us on iTunes and most podcast directories, or on our eye-catching website, redhothealthcare.com. Today's episode of Red Hot Healthcare is sponsored by Walk the Ridge. Incivility between those of different opinions and views is skyrocketing. It's causing harm to relationships as well as results in corporate culture. Walk the Ridge is a movement that's free to join, and it stresses that people practice tips and strategies in better listening and more civility. Join for free and download our free guides for individuals and businesses at walktheridge.org. That's walktheridge.org. Walk the Ridge, promoting greater civility in our society. Jacques Mulder is Ernst & Young's U.S. health sector leader. In this role, he leads teams in helping clients strategically address the transformative forces shaping the health ecosystem. He's also responsible for growing Ernst & Young's people, networks, and capabilities in the health sector, as well as developing industry-specific solutions and thought leadership. Jacques, I want to welcome you to Red Hot Healthcare. It is great to have you here live at HIMSS, a privilege and a pleasure.
Thank you very much. I'm very, very excited to be here, and thank you for the opportunity to speak with you.
In November 2017, you facilitated a panel event focusing on engaging the aging population. And I want to go ahead and pull away one of the quotes here that I got from the article. And it's, quote, "One of the main problems that came to light during my panel discussion was that these two domains, enterprise and patient, are not talking to each other as much as they should." The first question I'd like to ask is, because I know that you're very familiar not just with the healthcare ecosystem, but just the history of healthcare, is do you believe this has happened really because of the non-consumeristic fee-for-service system where maybe healthcare providers have been focusing too much on the payer instead of the patient as the true customer?
Thank you very much for that question. And I do think that you're correct. For the longest time, we had a very weighted focus on claims data processing, the financial systems supporting the operations. With this shift, as you rightfully said, of having the patient or consumer in the middle, in the center of healthcare, and the healthcare system surrounding that patient in such a manner that they can provide the best services and keep them as healthy as possible. We've seen the rapid development of a number of technologies, wearable devices, the ability to do diagnoses over the phone or get an EKG or whatever that may be. Many of us wear smartwatches or motion trackers. There is a wealth of information residing inside of the self-directed or patient-directed offerings and portals. We're at a place where a move to preventative care and also a shift to clinical quality is heavily dependent on patient engagement. I would go as far as saying that about 50% of the disease burden can be addressed with pharmaceuticals or surgery or other interventions, but the balance of that is really patient and consumer behavior. So taking a step back then and saying that the big pieces of technology that are focused on the enterprise and sustaining and supporting the enterprise as it operates, not being connected to the biggest risk element, having an impact on that enterprise, being the health and well-being of patients, and that there's no real channel to actively engage the patient population, makes it very challenging for us to get into the new frontiers of managing disease or being preventative or wellness. And frankly, anything at the population level is difficult to attain because we just don't have enough connectivity. So merging those two domains, to me, would solve a number of challenges that we have.
I read a recent LinkedIn article that you wrote. You said that in 2018, you expected uncertainty to be a persisting trend and that successful companies are going to work to innovate around uncertainty. And there's no arguing that right now healthcare is trying to find its ground. I mean, it's no surprise when Amazon and JP Morgan and Berkshire come to town that everybody starts scrambling because there really is no plan that everybody's jumped onto here to move forward. I guess with that said, I'd like to see if you might be able to give our audience, Jacques, some examples of companies that really in the healthcare area are innovating around this uncertainty, and maybe what sort of success that you're seeing from that.
So we're starting to see breakthroughs, the use of technology or just the curation of data. Working with an organization now that has the technology by using natural language processing, artificial intelligence, and a very well-structured taxonomy to be able to extract or mine information on the free text part of the clinical record. Now that could enable not only a move away from only claims data, but it really allows us to understand what is happening in the clinical domain. As I mentioned a little earlier, access to that clinical domain and to the patients is a significant portion of the driver of healthcare costs and inflation, and something that we at this point in time really have very little ability to intervene. We see companies like that being really innovative and saying, you know what, short of scanning everything, using a dumb example, we can now in real time update and merge and start searching vast multitudes of data, and at the same time not have to worry about the migration and how the data fits together, because it requires an entirely different construct. So we see companies doing things like that to access information and access patients and access care that was never available to us. If a patient presents with a fever, we can either call it a temperature, a high temperature, a fever, pruritus, and 5 other things. Each physician, clinician, caregiver has their own method, their own way of naming these, and they all use different words. So until we figure out that they mean the same thing, we're trying to chase 10 different diseases or 10 different symptoms, which are actually the same thing. It's at that level where this type of technology really enables a dramatic breakthrough and then brings significant synergies, cost synergies and others. It's faster and more efficient than the ways we're doing it today, and obviously a lot more incisive.
When we hear about leaders in healthcare and consultants in healthcare and experts in healthcare, and they're talking about lowering healthcare costs, Jacques, really I think that it's not the same language as talking about lowering patient pricing. When you look at any consumer industry, of which I think we'd both agree healthcare has not been a consumer-based free market industry, not for 50 years anyway, since fee-for-service started, really what we haven't seen talk about costs eventually, as they get lower, being passed on to patients in the form of lower pricing. And I'd like to get your feedback on this in the sense that now most of the first dollars are certainly coming in the form of high deductibles, and health systems are going to need to start competing on things, maybe perhaps even other than outcomes.
Great question. I continue to follow the mega trends because I believe that those are the ones that shape our environment most and are the ones that are most consistent. The fundamentals of consumerism and what we've been following is that the patient is now a real consumer who's deciding whether they want to engage with the healthcare system or not at the most fundamental level. They're deciding the manner in which they want to engage. And they are getting a lot more educated, not just on quality, but on their own experience. So suddenly you find yourself with a number of organizations that have to compete, like in consumer goods or in the automotive industry, in a very, very fast cycle that is dependent, and I'm using the word deliberately, on the whims of the patient and the whims in this case of the consumer, because the engagement is not just going to be post the diagnosis and now I'm sick and therefore I'm a patient. It is I am a lifelong partner similar to your cell phone provider, and you will be judging them upon the experiences, the service, the quality, and the price. And I think this is critical. The junction of those elements, the consumerism, the patient, cost, and then driving down the price to the patient, is dependent on the care provider's ability to manage risk. I look at healthcare as a big risk equation. It's very easy to keep on raising prices. It's no longer sustainable, but it's still happening. It's less easy to take out significant amounts of cost. And we see that a big part of the work we do as consultants is cost reduction, operational effectiveness, and efficiency. But I would argue that almost no one has gone to the point where they start competing on clinical quality. And what I mean by that, clinical quality specifically focused at reducing the cost of how you best treat a patient and keep them healthy. Those breakthroughs on the scientific part, the clinical part, I believe have been few and far between, and is going to be the frontier upon which competition is going to happen in an outcomes-based and a pay-for-performance-based environment. And it's going to get to a point, in my view, that companies are going to be competing on their own efficiency and ability to manage risk, and the winners are going to be the ones that can provide a offering with the right quality and the right experience for a patient, but probably at the best price. So it's going to take us a while to get to price, but the mechanism of price of getting to that point is not going to be cost reduction. It'll be the change in clinical behavior.
I think we're also going to see, too, just to add to that, Jacques, I see more health systems actually crossing state lines, especially with telehealth, and looking to actually capture and control populations remotely, or even forming partnerships with out-of-state providers, pulling together that way in terms of growth. When it's all said and done, I think HCA is going to get a lot of competition down the road, for sure. You and Carol Faig wrote a terrific piece on the difference between cost containment and cost optimization, which I read. I enjoyed it. In your own words, tell us the type of questions that provider organizations should be asking themselves, really when they're designing an operational strategy to achieve cost optimization.
Most of the questions I get from organizations are around growth. It's a very active topic around right now. And if we look at the trends in mergers and acquisitions, we can see that is definitely a race for scale, and a race for scale to be able to drive efficiency. Scale is helpful, and we started talking and continue to talk about smart growth. But what we mean by smart growth is, a lot of procedures are moving out of the inpatient setting into the outpatient or home care setting. Post-surgery care and a number of others are things that you can do by remote monitoring. When you think about growth, the first is I have to make sure that I do not build only upon the existing infrastructure I have, kind of looking for the car keys under the street lamp as opposed to where I lost them, actually. And that you shouldn't constrain your own organization by growing or expanding in manners that is not going to fit with who you want to be and what you need to be in the future. So we talked about patient in the middle. If everything is centered around serving the patient, then why does the patient have to travel past 5 surgery clinics to get to the one where that specific physician is or the one that you contracted with? So there are questions around how you build the physical infrastructure, and then there are questions around the types of services that you continue to provide. We talk about operational effectiveness rather than just cost reduction, but the operational efficiency of understanding where bottlenecks lie in an organization. So you may see 10 patients in the emergency room and you want to admit five of them. Whatever systems you're running says that you have 5 beds, correct, but they don't tell you that those beds have not been cleaned because the other patients are being discharged 4 hours later. So now suddenly you have a difficult situation. So when we look at the overall picture of revenue, cost, ROI, and organizations are going to compete in the future, you have to take a multifaceted approach. And I would say today that most of the questions I'm getting is around, how do I grow? Who can I buy? Or help me take out, another 20 million in cost. And my response to the 20 million in cost is always make sure that you don't, get yourself into a position where you no longer have the ability to exercise an option as you understand the future unfolding.
Representing Ernst & Young, Jacques, you stepped out to give some additional predictions recently on where you see the biggest healthcare technology impact coming in 2018. Now, there were 2 areas in particular that I was very interested in, and there were 2 different terms. One was called data fusion systems, and the other one was called global ecosystem of peer value creation. So both of those sound like a mouthful. I would love for you to go ahead and just explain these terms, if you could, to our audience, just on a very high level, and then perhaps maybe, where you're seeing their strength of impact.
Data fusion systems is a term that I use for data aggregation and migration. But the specific ability, as the example I used earlier, to find disparate words that in fact have the same meaning and try and draw or harmonize the analysis of those data by being much more specific in how you group and segment the analysis. Now, without getting into the mathematical exercise. The point is just this: data is coming in from multiple different sources, patient domain, as well as from as from the EMR systems. We've got huge breakthrough coming in the clinical data piece within those domains, and we are expecting a merger potentially between the consumer and the enterprise domain. So now you have multiple data sets, multiple data sources, wearable devices, clothing, watches, smart devices in your home, and your iPhone or your Android phone, generating information about your health, well-being, how much you move, how much you eat. All of this has to be developed in a cloud around the patient, multiple inputs that we can then find a way to normalize and understand or interpret. So that was really the issue around data fusion systems. When we talk about global ecosystems of value creation, healthcare is becoming global. Not only are the brands becoming global, but the services that were predominantly provided within the United States is now being sought after very heavily in other parts of the world. Electronic medical record implementations, and a number of those are becoming export products from the US. But we're seeing this growth of international ecosystems, multiple industries surrounding healthcare. And I say healthcare in the middle because that's my own passion, but many of them intertangled. Consumer business is no longer removed from healthcare. The telecom business is no longer removed from healthcare. As a matter of fact, some of the top cell phone providers in the world are spending more on basic research than some of the biggest pharmaceutical companies, and all focused in healthcare and the engagement and the interaction, the intimacy with the patient. As we see these entrants step into the world of healthcare, many of them bring technologies and skills without necessarily a healthcare background. But the application of them has shown us that they break all the rules. They do things better. The innovation is strong, and no longer are we holding ourselves captive to solve the problem with only the things that we have, which to me is exciting. So the role that we as EY play is a navigator of that ecosystem. Because of the footprint that we have and the work that we do globally, we have a bird's eye view on almost everyone that is playing in the space. We have great feeder networks in our innovation programs around the world. Our Entrepreneur of the Year programs, where we have 40, 50, 60,000 companies profiled, and where we've helped them become successful. So if you think about HIMSS or a major conference, and you just look at all of the logos that are around the exhibition halls, ask yourself this question. At some point, all of these are going to get bought, sold, merged, or someone's going to absorb a technology. And if you look at that, you will understand that there's a major role and a need for a global view on the evolution of ecosystems and the evolution of scientific and data-based ecosystems. So as we go forward and try and solve bigger problems like cancer or other things, and we just have to have a much greater view, those ecosystems, I believe, are going to get us to the place where we can solve healthcare problems that we cannot solve today.
I want to go ahead and ask this question, bit of a wild hair. What is one thing that you believe to be absolutely true in your mind that very few people would agree with you on?
I have a deep belief that the future of healthcare, and especially on the back of the new entrants, non-traditional entrants into the healthcare space, is going to revolutionize care for really two very basic reasons. One, it is very, very difficult to get into the clinical parts of care without understanding what the contribution of those elements, those clinical elements, are to the overall cost and clinical equation. What's most important, and I'll just kind of get right to it, is I believe that entrants from outside of healthcare are not only going to be aggregators because they try and buy medicine for their employees. I believe that they're going to start having an active hand as an employer in healthcare that's going to go beyond the selection of a pharmaceutical benefit plan. And I fundamentally believe that through the use of technology and science, we will get to a point where they will develop algorithms of care and they will start assuming risk of their own, because ultimately, outside of the government, employers are the biggest payer. And they're also the one carrying the can for absenteeism, productivity issues, and a number of others that go hand in hand with challenges in an individual's health. The example that I would use, and this is just to kind of make the point, a small hospital in Pick a town.
We'll call Tulsa, Oklahoma.
Tulsa, Oklahoma.
It's always my favorite town.
Tulsa is a great town. Admits a young patient, 9-month-old baby with viral meningitis. And the question that they have for the physicians are, do we intubate this baby or not? And sought out experts from around the country, 4 or 5 of them from all of the premier schools. And, well, the answer came back 50-50. Some say yes, some say no. Well, they were able to find a database that went back 15 years, and they found 5 patients that presented in a similar way. 3 of the 5 were intubated. The 3 of the 5 survived. The other 2 that were not intubated did not survive. That piece of data would never have been available to assist in the decision of clinical decision making, in that clinical decision, without an external intervention in a trading platform that wasn't interested in owning the subject or the outcome or the patient, but merely said this was the best way from what we have seen to treat in that specific circumstance. And the organization that did that was entirely naive to healthcare. Very exciting times ahead of us. So when I say employers are going to be stronger than they are today, and that we're going to be running healthcare and clinical decision making, probably on the back of artificial intelligence that has got its basis in real data, I get a lot of really squint looks from across the room.
Jacques Mulder, Ernst & Young's U.S. health sector leader. Jacques, I want to thank you so much for making time for us today here at HIMSS 2018 and on Red Hot Healthcare. I know you are extremely busy. Your time is valuable. And I'm just really thankful you decided to spend it with myself and with our audience.
Thank you for the opportunity to speak with you. And thank you for the great work that you guys are doing.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.